us a message in the chat. And good morning, everyone. Welcome to the webinar, the inaugural webinar for 2024 here at Cornerstone. This is the Individual Corner, and today we're going to review open enrollment and look ahead at 2024. And on the call with me today is Brad Petrella. Say hello, Brad.
Hey, good morning, everyone. Thanks for joining us.
And he's the Business Development Director for Northern Ohio, and on the call as well, Jess Larkin. Say hello, Jess. I know she's on the call, maybe. She's on mute right now. But
I'm sorry. Hello, everyone.
Oh, that's fine. And of course, I'm Geoff Beglen. Can everybody hear us okay? If you got any questions, throw them in the question box. So we'll get started. Just some housekeeping. If you have a question, put it in the question box. We'll get to them at the end of the presentation, and Jess is kind of monitoring that for us. And as more people filter in, good morning. Good morning. Here in Cincinnati, it's kind of rainy, but thankfully most of the snow's melted. But here we go. So if you got a question, put it in the question box. We'll get to them at the end of the presentation. And then let's talk on Cornerstone. We were founded in 1985, family owned. We're licensed in all 50 states and 6 regional offices throughout Ohio, more than 70 employees and 3 decades of experience. Our owners are Ryan and Annie Carroll, 2 proud parents now. So delighted about their new additions to their families, and just terrific. And, as I mentioned earlier, Brad is the Business Development Director for Cornerstone.
I got a promotion.
And Brad, talk on your experience with Cornerstone and the regions that you service.
Sure. Again, Brad Petrella, Business Development Manager. Thanks for the promotion. I hope our boss is on so he hears that you just made me a director.
Okay.
So I joined the Cornerstone team in April of 2023. So it's been a great, it's now, 9 months. And so a lot of learning, new market for me in the ACA business and individual market. But it's been great to work with such a great team. And I cover sort of the eastern half of Ohio. So from Lake Erie down to the Ohio River. And most of the business is obviously in Northeast Ohio with 3 of the major cities in the state here. But if you need me from down in the southeastern part of the state, there's my phone number, there's my email, always available for you and, well, any of you. So Geoff and I are a great tag team.
Fantastic. And by all means, if you need me, there's my phone number. I'm the lead account advisor here at Cornerstone. Been here 17 years, and we'll get you up and running in the individual market. And let's talk on open enrollment, the year in review. So just want to dive into this and give a short overview of what we saw out there and what we see in the future. And real quick, this was a big year for the ACA. It grew tremendously by close to 5 million members. It was a big year. We're now up over 20 million lives in the Affordable Care Act, Obamacare, if you will. And a lot of that's attributed to Medicaid redetermination. A lot of folks had to come off of Medicaid. They were on provisional coverage because of COVID, and then they had to come off, and then resulting in a lot of additions to the OEP, the Obamacare rules. And another phenomenon we see is a lot of early retirees, what we call the Great Resignation. So that's contributing to a big increase, maybe the biggest increase year over year we've seen. And like it says, 25%, a big opportunity for all of our agents. And then let's take a look at Ohio. By the same token, Ohio saw a huge increase, maybe bigger than the national level. And again, I attribute that quite a bit to Medicaid redetermination, Medicaid being shut down for a lot of folks. And I think we're seeing even more retirees, early retirees here in Ohio. And that resulted in a whopping 62% increase for the ACA year over year. So we're getting these statistics from ACA signups. So they do a wonderful job um, calculating all the data in the market. Good morning, Francie. And folks are still filing in, but as we keep rolling along here, we're just giving an overview of the ACA open enrollment um, for Ohio, and let's talk on how things broke out market-wise. So really, four carriers comprise almost 80% of the market share. And this is based on data that I pulled from Health Sherpa, which is an enrollment platform. And I'll share more about that in a little bit. But 80% comprised with Ambetter, Anthem, CareSource, and MedMutual. So there is the pie chart. Molina also was a big player, and then it kind of tapered off a lot. And I attribute that a lot to these big four carriers being around for the past 10, 15 years, well, actually 10 years, and having brand recognition, and what's more, they seem to have the most um, hospital networks out there. And if we can, I'd like to just dive into some data. These are by no means representative of, um, you know, the actual market breakout in a specific region, but I'm just looking at maybe a top agent in our area and what she or he saw out there and what her sales were like, or his sales were like in in a region. And for example, I took an example of the top Cincinnati agent, and a big portion was Anthem, and I attribute that um, quite a bit to their hospital network. They don't have all the hospitals in Cincinnati, but they have most, and they were also competitively priced. MedMutual was also a force to be reckoned with. They just added Children's Hospital to their network, and that was a big addition for them. And I believe they added Christ Hospital as well. Um, I do want to point out that Cornerstone does not market Medical Mutual, so don't call me or Brad if you got questions about Medical Mutual. I'm just relaying the facts here. That's not one of our partners, but MedMutual was big. I do want to point out Ambetter, who is one of our great partners. They did quite well. Um, they have most of the hospitals in the system as well, and they were competitively priced. And then things kind of tapered off. Um, Molina held strong. CareSource lost some market share due to pricing, and they're not maybe as strong as they used to be. They took a price increase. So that's the Cincinnati market. That's what one of our top agents did in Cincinnati. So, and let's look at one of the top agents up in Western Ohio. We call this the Lima region. Lima kind of bleeds into Indiana a little bit over there towards Fort Wayne. It also is kind of smack dab center in Western Ohio. And this person, they saw a big increase in CareSource because of pricing, and that was in large part taken from Ambetter, who had price increases over the past few years. By all means, if you have any questions or comments, throw them in the question box, and we're going to get to those. And then let's talk on Mansfield, Ohio, North Central Ohio, another key region, one of the top agents up there. Held strong with Molina. Molina's always been a big part of North Central Ohio. They've got some of the better hospital networks. It's kind of a borderland between Columbus and Cleveland, and Molina does quite well there. And rolling along here, I'm just getting through some more of these case studies. Chillicothe, South Central Ohio. Molina was very strong there. They have most of the hospitals that are in the Chillicothe area. Again, this is just a snapshot of what one agent did. And it is a pretty decent picture of what the market's like down in Chillicothe. Um, and then Zanesville, this is more like central east Ohio. Again, CareSource, pretty strong over there. They've been strong in um, southeast and eastern Ohio for many years. And not as much growth in Anthem, maybe as you'd expect. Anthem is in all 88 counties, but they still have some work to do over in eastern Ohio. And I'm going to talk on the Cleveland market, and I'm sure Brad can chime in as well. But Oscar has always been strong in the Cleveland market. This agent did really well with Oscar, and their selling point, first and foremost, is their affiliation with the Cleveland Clinic. And we've seen a little bit of loss with Oscar. They've taken some price increases, but the Anthem is not a big player up there, but Ambetter is, and Ambetter's added some market share in the Cleveland area with this agent, and that's what I've seen across the board. So some other, we don't market SumaCare, obviously they're in Summit County, and that's a strong point for them.
Geoff, let me go
Toledo,
back. Can you go back
yeah,
very
let's go
quick?
back. Brad wants to talk on Cleveland.
Right, and this is interesting because in one of the very early slides, you saw a very thin sliver for Aetna. So this is where they had their greatest traction, and I just looked at the numbers this morning that I received from them, and their three top counties from 1 to number 3 were obviously Summit County, followed by Cuyahoga and Ashtabula, were their three strongest counties. So if Oscar has the Cleveland Clinic, they're one of the largest national carriers that has the other hospital in town, University Hospital. So interesting to see that. And also another one of the even smaller slivers was SumaCare. And obviously this is their footprint in Northeast Ohio. So interesting to see this mix. It's a pretty, if you look at it from, sort of a more balanced portfolio. So here's an agent or broker who's selling on price based on subsidy and network, which are the two biggest, as you can imagine, or as you know, the biggest considerations when somebody's shopping for a plan. So back to
Great,
Toledo. Yeah.
great. Thanks for that insight. Thank you.
Yeah,
Thanks,
sure.
Brad. And Toledo is just, it's Northwest Ohio. It's, part of that whole area. Lima sort of bleeds into Toledo, and as a result, we saw a pretty big increase with CareSource up in that area at the expense of, I think, Ambetter taking price increases. But Ambetter is still very, very strong. Don't get me wrong; it's very powerful in Northwest Ohio, and one of the advantages they have is they have tremendous hospital networks. So Ambetter is a force to be reckoned with. They are the biggest ACA carrier in the country. So and a huge portion of sales still with Ambetter, but in this case, this agent put more with CareSource.
Geoff, before you move on, there's one I'd like to just poll the audience. So find the chat button there at the upper right-hand corner, and just let us know who was your top carrier that you wrote the most of this year. Maybe just factoring in new business, not necessarily your total business with renewals. It'll be just interesting to see what some of your inputs are, if they match or are similar to what we're seeing here. So we'll give it a minute. I'm just really curious, and give a little active engagement to make sure that you didn't all go to get a second cup of coffee or a third. They're not finding the chat button. Well, we'll just keep moving and we'll take a look at those.
I think Jess can access the chat button.
Yeah, I can't
Jess,
see
you
it.
see the chat button? We've got a new setup here. So,
all right.
Yeah, we're starting to get some.
Okay, fantastic.
Good.
Okay, was there any comments that we can include, or?
Well, Steve Brubaker says Anthem was his number one. So that that matches. Good.
Okay.
Come on, folks, keep them coming. It's not that hard to type. It's Tuesday. It's not Monday morning. I could see where we would have a little slower to the trigger. Okay, Lucy with Medical Mutual.
Okay.
Good. All right. I guess the rest of you want to be quiet, so that's fine. Oh, the chat's not working, but that's right. Jess did say she wanted everything to go into the questions, not the chat. So sorry about that. There were conflicting slides there. Why don't we keep moving forward, Geoff, and we'll just take a look at this. It's a great curiosity. So looking ahead to 2024, just wanted to point out a couple of things which you may already know. If you don't, we'll be sure to send out these two slides to all of you so that you have it as a refresher, pin it to your wall. But as you see, the commissions for the carriers are by and large $18 to $20 range for most everybody. I'm not going to read them all to you. You could see them just as well as me. And I wonder as I look at this with Molina's market share in Ohio, is it reflective of their $16 per member per month commission? Maybe. I don't quite know, but interesting. Look at that. And just to be, for those of you that are newer, and I know that there are many on the call that are, talking about Anthem, they pay only for 2 members maximum per policy. So that's the most you're ever going to get with Anthem, or 2 people. And you're seeing a new name there, which some of you may not be familiar with. We were promoting them in the fall. It was a little late in the game, right before open enrollment, but Antidote. They are not on exchange. They didn't get their approval from CMS. So they are an off exchange carrier. Their big notation is that they're a virtual first carrier, but it's like a 3-tiered system. People could go directly to their provider, just pay more for that. So if you're interested in learning more about that, we'll be doing a training here not too long from now, but you can also let Geoff or I know if you would like to be contracted with them. They are a second option for people who want the Cleveland Clinic. So they're the only other carrier that gives access to the Cleveland Clinic, but it's going to be for your off-exchange clients, right? Those who are not going to get a subsidy anyway, and maybe you want to save a little bit money on premium. So just wanted to point that out. And Medical Mutual, interesting statistic here. Young adult, they're paying $10 per member per month, and this is for any adult under 30 years old. So that's an interesting tidbit as well that I didn't know until recently. So next slide. And so here's the great thing, and we saw a lot of big numbers from you all, and there's some great carrier bonus programs out there, as you can see. And again, not reading them all, but what we did is here in that second column, we put the minimum threshold. So you're seeing 15, 20, 25, they're all in that range. And Anthem in Kentucky, you're getting a $50 bonus from application number 1. I guess 0 would not be the right statistic there. But it continues to increase as you start getting to phase 2. And in phase 3, you're seeing some numbers. Aetna has a $125 bonus for 60 plus. So I don't think anybody got that, and maybe somebody got that first level for Aetna. So just a great informational piece to have. We'll be sure to send these 2 slides out to you all just to pin on your wall, put on a folder, wherever you like to keep it, just as a great reference material. Next.
Let's talk on FFM. So this is something.
Geoff, we lost you.
Okay, can you guys hear me? The mute button
Yes.
went on. So I'm back. So it's the point of emphasis. the FFM certification is open, and why this is so critical is you all need to be certified to sell on the AC. I know that seems redundant and obvious, but we still have a lot of agents that they just enter the market and they're new and they want to get appointed and start selling. And this is where we jump in. We help them um, start the certification process. In order to do so, there's a button here that you can click. We'll send everybody a copy of the presentation, and it'll also be on our archived on our resource center. Um, this is critical for those new hires that you bring into the agency, get them up and running, and we can help them with all these processes and what needs to be done and tips and tricks to be added as a new agent. We have a lot of new agents coming on. And what's more, I do want to point out that the FFM certification allows you to do some really cool marketing strategies, namely the help on demand feature that the FFM provides. It's a free referral program. In other words, you would add your name into this mix as an agent, and when somebody is shopping on healthcare.gov and they ask for assistance from an agent, they can click a button and you would get a text, and that will allow you to reach out to a client. You have 15 minutes or so, and talk to that client about selling an ACA plan. So that's all part and parcel to the FFM certification. So a great tool, a great marketing strategy is that help on demand feature through the FFM certification.
Yeah, and I've heard from several agents that said they're actually getting 3 to 5 leads per week that were closable leads. So if you're not doing it, please do the help on demand setting in the FFM portal, because who doesn't like 3 to 5 extra leads a week? And again, that's open enrollment. They will tail down a little bit the rest of the year, but hey, a couple a week is no small feat to get 8 to 10 new clients a month. So kind of helps pay for
Absolutely.
yeah.
Everybody's looking for a cost-effective marketing campaign, and this is free, so it's a no-brainer. I want to talk on Health Sherpa for a little bit. This is really our ace in the hole. This is an enrollment platform. It's the largest ACA enrollment platform. I don't work for Health Sherpa, okay? I don't get paid by them, but I've found them instrumental in getting clients enrolled and the ease of use. We've been through 3 or 4 different enrollment platforms. This is by far the best. It's free. I want to point that out. It's free, and it's the only one right now that's partnered with CMS um, to do enhanced direct enrollment. That might be changing, but to my knowledge, it's the only one that has a super fast enhanced direct enrollment. It is the largest ACA enrollment platform in the country. What's more, the majority of what brokers sell on Obamacare is through Health Sherpa. That's a fact. So one of the things that we like about it is there's no redirect to healthcare.gov. It's got that multi-factor authentication. You can read the rest of it. What I really like is this bullet point here, reporting and analytics. This is where I generated those statistics earlier. So it's really cool. These analytics help you break out, what the carriers are doing, which carriers are hot and which ones are not. It allows you to do something called an NPN override, essentially allowing you to place all the business with one person in an agency, and you can all imagine how convenient that is. Not everybody has to get appointed with every, carrier in the state, which right now is something like 10 or 12 carriers or something like that. You can do an NPN override and maybe get the principal, as the principal writing agent. And talk to us about Health Sherpa. I'm your coordinator for Health Sherpa, and we can get you started on that. Send me an email. Send me an email if you want to get started on Health Sherpa. And by all means, if you have any questions, put those in the question box, and Jess will address those at the end. Just a few more facts on Health Sherpa I touched on earlier. Most of them get a CSR, and it breaks out 54% female, 40% male, 46% male, and the median age is no surprise here, 48. So we're seeing early retirees, and that demographic sort of pushed the median age to the late 40s. And I'm done with Health Sherpa. Brad, take it away on dental and ACA.
Yeah, sure. So just wanted to point out, so you're aware, if you weren't already, these ancillary carriers that we work with. So for dental, we've got Anthem, Emeritus, which is our largest written ancillary product. 3 simple plans that give you, that are based on zip code, not age, not gender. So if you're not appointed with Emeritus, let Geoff or I know, and we can help make that happen. It's a pretty simple contract process. Cigna Dental is a new carrier for us. So again, if you don't have them, Cigna has been in the dental business for quite a long time. Then we have, of course, in Cincinnati, Dental Care Plus, which has had a very large network. And then only in Kentucky do we have Delta Dental, not in Ohio. And then there's a Humana Dental plan, which I think for us has primarily been written for small groups, but can be written individually as well. And then I think the largest thing, and some of you might actually sell more short-term health plans than you do ACA. For various reasons, some of your clients want a PPO network. It's the only way to get a PPO network is through a short-term plan. However, they are underwritten where the marketplace plans are not underwritten, which I think you all know very well. But we have 3 of the largest carriers representative for short-term products, and that's United Healthcare One, formerly the Golden Rule Company, as well as Allstate, which was formerly National General, and then of course the Anthem Enhanced Choice Dental Program. All 3, I said dental. Short-term plan, all 3 very, very strong plans. Each of them does something a little different. Again, in upcoming webinars, we're going to have all of those carriers on for a training, and there's something with UH1 they've rolled out where they've sort of repackaged and rebranded their dental, vision, and hearing program. Ohio does not. I don't know why Ohio has a hard time offering or letting carriers do hearing plans, but we're going to have a training on that, I think, near the end of February when they're in full launch mode. So be on the lookout for that training schedule. We're going to be doing these trainings every week, a different topic, hopefully alternating between Geoff and I with certain things as well as a carrier. So we've got a schedule lined up all the way through May for your enjoyment, pleasure. So next slide.
Okay, great.
So target markets here, especially if you're new, as Geoff has talked about quite a bit, early retirees, bridging the gap to Medicare, but not just early retirees. We have a lot of entrepreneurial clients like yourselves who don't have a group health plan, and this is their platform to buy for their themselves, their family, and maybe, and I'll get to it in a second, maybe for some of their employees, those who are job surfing. I know this is a segment of the market. This is talk about short term. This is very short term. So I don't know that I would go out and beat the bushes for people who are job surfing, because you'll probably lose them to an employer-sponsored plan within 6 months or less. College graduates, interesting. Maybe some parents are saying, like maybe I will in 5 years, that I'm done paying for you, especially while you're in the job hunt. So there are opportunities. Many of you live around at least a small college or university or a large one, they often have fairs for their students. So check out and see if it's possible to get a table there. New state residents. So this is a tough one, but many of you are probably in the PNC business or are affiliated or are tagged up with a PNC broker. Guess what? When somebody's new to the state, they usually either need a renter's policy or new homeowner's policy. So that's a great segment to find somebody coming in into the market. New young families like our owners, Ryan and Annie, if they were on their own and weren't sponsoring an employer plan, they would be looking for something themselves for their family. And as Geoff mentioned earlier, the Medicaid redetermination. And last but not least, ICHRA. So let me talk about ICHRA a little bit in the next slide. It better be the next slide. So what is an ICHRA? So this is an acronym that dogged me for, I don't know, the last several years, and I didn't really quite understand it. But since I joined in April, this is something I've really kind of taken charge of and really trying to develop a bit more. So what it is, it stands for Individual Coverage Reimbursement Arrangement. So health reimbursement arrangement. Looks like we forgot a letter there. So what it's doing is it allows an employer to reimburse employees for the cost of purchasing their own health insurance through the marketplace, right? And so why this is becoming so much more pervasive and growing is because, over these last few years since COVID, carriers are seeing huge claims, things were delayed, things that they would have seen, year over year, but they were accelerated, right, by people holding off. And so they're not, they're delivering renewals in the double digits. And I'm not just talking about a 12%. We're talking about sometimes in the 20s and 30% range. I heard from one of our teammates who works in the group space, she had to deliver a 50% rate increase. Not many employees can swallow a 50% rate increase, right? Especially if you might have 30 to 50 employees. So it's allowing them, for the employer, to offer something and giving money for it, right? And there's a whole series of calculations that you do in terms of affordability. Yes, the employee doesn't get a subsidy, but they are getting a subsidy by way of an employer contribution, right? And so the adoption rate of ICHRA has grown. And, and again, this is a trajectory, but if you look at the third bullet, 64% growth rate in employers adopting generally it's small employers under 50 employees, but you'll see in the statistics a little bit lower, it's primarily under 20 employees. So 64% is nothing to shake a stick at. And so 64% of the growth comes from those employer groups with 5 or less employees, may include their families as well. But then 24% fall in that 6 employee to 20 employee category. But 2 weeks from now, February 3rd, we're going to have a whole hour training on ICHRA. So I think if, based on the previous bullet of under 5 employees, under 20 employees, you all know friends or business associates or from your networking group who fall in that category. So this could be a great opportunity for you to enter a new market related to a market that you're already in, and that's the marketplace. So, join us in a couple of weeks. I believe that invitation has gone out or is going out here by the end of the week. So definitely join that if you're interested in learning more about it and making a splash in a new business segment for yourself. That's all I have. I think we just have questions.
Yeah, fantastic. Let's field some questions now. Jess, what do you have?
I'm not seeing anything in the question box. But maybe they will.
It looks like we did have, we had two answers for the most sold carriers. So it was Medical Mutual and Anthem. And then Ambetter and Molina. And they said that CareSource is not in their network for Blanchard Valley. So very few CareSource for Hancock County.
So that would be Findlay, Ohio, folks. Findlay, Ohio, a key market for us. And that's Blanchard Valley is, I believe, Ambetter territory. So that's heart of Findlay, Ohio. And I do want to point out, you probably noticed, we didn't have any stats on Columbus, right? Columbus. So Health Sherpa wasn't able to provide me with that data, but I do want to point out, anecdotally, in the Columbus market, Molina does very well. Anthem is, very competitively priced. They don't have Mount Carmel, but they do have Ohio Health now, and Ambetter holds their own in that market as well. So we look at the Columbus market; it's kind of spread out a little bit, and there's unfortunately not a lot of crossover between carriers. Either one carrier latches onto one hospital system at the exclusion of another system. So that's the Columbus market in a nutshell, if you're wondering. So we're about to wrap things up. If you guys have any more questions, please put them in the question box.
Yeah, it looks like we got a couple more questions here. The one question was, were the Dayton stats and the Cincinnati stats? And then there was another question, what about the Dayton market?
Again, I didn't have good stats from Health Sherpa on the Dayton market, but anecdotally, the Dayton market is 2 hospital systems up there, and Anthem did really well in that market. They grabbed some market share from CareSource this go around, and MedMutual. Again, we don't market them. They did fairly well in the Dayton market, and but Ambetter was very strong in the Dayton market, as was
And then we actually have a slide on Cincinnati that Fawn is asking about. That was probably the second slide in all the pie charts. I don't know if we want to go back. There we go. Cincinnati, Geoff, one more back. So Fawn's a newer agent, and I think she's just trying to get a matter of perspective. So Anthem, MedMutual, Ambetter, and Molina are the top 4 carriers. Not too far on his heels, followed by CareSource. So sort of the biggest in the marketplace, Fawn. And again, just you could see just this carrier, this agent or this broker wrote just about every carrier that we offer, and then a couple others that we don't have wholesale contracts with. But
yeah,
we're always on the make for trying to get some buy-in from some of those statewide carriers.
Absolutely. Anthem, they're very strong this year. I want to say they were probably the biggest gainer of all the carriers statewide. You look back 5 years ago, they weren't even in the market. They were completely out of the Ohio market aside from Pike County. And they've come in the market, and they have done some hospital contracting to the point where they're very popular in most of the metro areas, and this bears that out. You can see in Cincinnati, they're tied for number 1 with this agent, and I think overall, when I look at the data, they were number 1 for us for Cornerstone down in Cincinnati. But again, do you have any more questions?
Geoff, there's one that Steve's asking about. Just I'll read it to you. You can answer. Are bonus commissions? Yeah. So Steve Brubaker is asking: are bonus commissions only for new business or for the block of business? Great question. Got to believe it's new.
Some of it's new, and some of it is for the block of business. Again, with the ACA, these are in large part for new business, but remember, with the ACA, you basically write new every year. Most agents are renewing clients into a new plan, that would count as new business. So when you rewrite it, that's new business. So um, that's what they're
Pretty
going
cool.
off of. But if we want more detail, we can send out the specific carrier um, presentations on bonuses because that has all the details and all the language in it. I hope that answered your question.
Yeah, and it's also on the resource center, but this individual team developed a really great hospital network page for, all throughout Ohio, 3 pages, every carrier that we market, their network. So it's really great. If we're sending anything out, I'll make sure that we send that network page. But if you do go to the resource center, um, it is loaded in there, so you can just download it from there. So it's a really great. I keep one on my desk at all times. So have a look for that. And I think looks like everything is slowing down, so I don't see any new questions. So I think
Okay,
we wanted to keep this short so that you all can get on your way and work with your clients, uh, whatever you have planned for today. We want you to do it.
fantastic. And with that, we'll conclude the presentation. Everybody, have a great day.
Have a great rest of your week, everyone. Take care. Bye.